Hi, and welcome to another episode of Punk Rock Politics with John Smith. I'm John Smith. So let me just squeeze this seat over a tad there, make it more comfortable there. So in the last video, we were going to talk about how the people in power screwed up, and we started off with an article about that. But then I played a podcast, and I didn't listen to the podcast first, and I wish they touched on more issues sooner. But you know, it's a podcast, and there's a bunch of guests, and they're all giving their perspective, and we're just getting to know them because I've never heard their podcast before, and they said some interesting things and some things that I didn't get a chance to critique because it went on for quite some time. I'm going to go through that video and add on some more discussion about why the people in power screwed up. After this, if there's more to that video. If not, I'm going to do, I can't wait to get to my, how the mainstream media is hiding the Never Biden movement, and has been for like weeks. So this is an older video, but it's very relevant. So check this out. This is from The Nation, or thenation.com. It's filed under coronavirus, Andrew Cuomo, and Medicaid. Cuomo helped get New York into this mess. The governor's position on health care spending looked starkly different a couple of months ago. By Ross Barkan, March 30th, 2020. There's the guy that people think should replace Joe Biden, when the obvious solution to replacing Joe Biden is to opening up the process again, the DNC getting rid of Joe Biden because of the credible allegations of Tara Reade, because of his clear dementia and him being hidden from the media, from his poor response to coronavirus, to the fact that he's only a presumptive nominee and has not gained enough votes to become the nominee by the DNC's rules. And he is just awful, has an awful record, and will lose to Donald Trump very likely. Anybody could beat Donald Trump with a pulse, but also many people can lose to Donald Trump, even competent ones, or people with a big staff and a lot of money that are incompetent, like Joe Biden, having the DNC essentially run his campaign. Editor's note: The Nation believes that helping readers stay informed about the impact of the coronavirus crisis is a form of public service. For that reason, this article and all of our coronavirus coverage is now free. Please subscribe to support our writers and staff and stay healthy. As the novel coronavirus rages in New York, killing more than 1,000 and locking down millions, Governor Andrew Cuomo has emerged as the hero of the moment. On television, he is everything Donald Trump is not: calm, coherent, and blunt in a strangely reassuring way. He is becoming a #resistance hero. Some people are literally falling in love with him. But the same Cuomo who is racing to expand New York's hospital capacity and crying out for more federal resources is quietly trying to slash Medicaid funding in the state, enraging doctors and nurses and elected officials of his own party. The same Cuomo who holds press briefings at a major New York City convention center, now the home of a temporary 1,000-bed hospital, presided over a decade of hospital closures and consolidations, prioritizing cost savings over keeping popular healthcare institutions open. It's the same Democratic governor, every liberal pundit's tried and true Trump antidote, who is doing damage to his state's healthcare system at the worst possible moment in the eyes of the critics who follow him most closely. Had a caricature, a cartoon presidency. All right. Andrew Cuomo has repeatedly stated, excuse me, I had to pause it, my dog's going nuts. Andrew Cuomo has repeatedly stated over and over again that New York has excess capacity of hospital beds, that it's too expensive and not needed, and we need to reduce spending. He said this over and over again throughout his entire tenure, said Sean Petty, a pediatric nurse at a public hospital in the Bronx and a high-ranking member of the state's politically active nurses union. If this budget goes through in April, next year's health and hospitals budget is going to be devastating. What's striking to Petty and other healthcare experts is how Cuomo has not backed off his plan to cut Medicaid despite the horrific COVID-19 outbreak. Earlier this year, Cuomo impaneled what is called a Medicaid redesign team to slash Medicaid spending in New York after a $6 billion budget shortfall, driven largely by rising Medicaid costs, became evident in late 2019. Medicaid enrollment has been growing about 13% a year and is now a $70 billion program in the state. More than 6 million New Yorkers are on Medicaid, which has meant just 4.7% of the state is uninsured, a historic low. The Affordable Care Act has boosted Medicaid enrollment in New York. Though Medicaid is a federal program that provides low-cost comprehensive health care to the poor, the state still picks up almost half the costs, with county governments also bearing a small share. Some of the budgetary abyss has been the Cuomo administration's own making, postponing Medicaid payments and failing in the past to iron out inefficiencies like the states paying Medicaid costs for relatively wealthy private hospitals that don't need the aid in the first place. Despite his reputation as a big government progressive, Cuomo has held to a self-imposed caps on state spending and property tax increases, putting additional strains on local governments trying to fund municipal services. You want to target whatever cuts are necessary and target in the smartest possible way, said Bill Hammond, the director of health policy at the Empire Center, a right-leaning think tank that frequently analyzes healthcare spending in New York. You want to go after wasteful programs, but you want to try to protect the needy, the vulnerable, and seriously ill and disabled recipients. Medicare is a lifeline for so-called safety net hospitals, the public institutions serving the urban poor in New York City and the rural poor in the northern and western reaches of the state. These are the hospitals on the front lines of the COVID-19 crisis. Struggling for support in ordinary times, their patients usually lack the sort of private health insurance that offers generous reimbursements. They are now on the verge of collapse. Elmhurst Hospital, a Queens public hospital at the center of the pandemic, is so overwhelmed that a refrigerated trailer is stationed outside as a makeshift morgue. It's obscene, said State Senator Gustavo Rivera, a Bronx Democrat who chairs the Senate Health Committee. These are immoral actions that the governor is taking. With the state budget for the next fiscal year, on April 1st, Cuomo is proposing to gut Medicaid by $400 million, part of $2.5 billion in cuts he's seeking over several years. So determined is Cuomo to slash Medicaid spending that he's prepared to reject more than $6 billion in matching federal aid approved earlier this month because it would force him to alter his austerity strategy. This is an older article, so that has actually changed. And I did this in my 4-part series. Andrew Cuomo was the worst. Definitely check those videos out. But that's changed. So what he did was he allowed... he's going to get the federal funding for Medicaid, and then right after he gets that money, then he's going to cut Medicaid in the state. And he's allowing himself to have that power in the budget after the fact, which is insane, and everybody should be crying foul, and that's super authoritarian, and it's just the control that guy has in the state over even the well-intentioned state senators and representatives is just incredible. And control he has over all the politics. If Cuomo gets his way with the state budget, many of the city's most besieged hospitals will lose money at a time when COVID-19 is threatening to crash New York's healthcare system. Central Brooklyn hospitals, serving many of the borough's working class and poor, could lose $38 million a year. Manhattan hospitals could lose up to $58 million a year. The virus is just one illustration of why it's important to have a strong public healthcare system, said Naomi Zodi, an assistant professor at the Graduate School of Public Health and Health Policy at CUNY, or the City University of New York. Great school. Depending on what you go for and where you go, which one. The proposal to cut funding, I should have went there, not where I went. The proposal to cut funding to public hospitals during a pandemic reflects really poor decision making. Cutting Medicaid has been a priority of Cuomo since he took office in 2011. In his first term, another Medicare redesign team shrunk Medicaid reimbursements, damaging the financially fragile healthcare facilities that serve low-income patients. Hospitals, meanwhile, have been shutting their doors across the state. Part of this reflects a national trend toward consolidation and a movement to ambulatory and outpatient care, as well as the inflation of medical costs and a change in federal reimbursement formulas for Medicare and Medicaid. What's more, the state has lost more than 20,000 hospital beds over the last 20 years. Cuomo, who has governed for almost half that period, never advocated for any kind of expansion of hospital beds until last month. He now says New York needs 110,000 beds, more than double the current capacity. He has never been a forceful advocate for keeping hospitals open. In fact, he's empowered bureaucrats who've argued aggressively to shutter them. In 2006, under Republican Governor George Pataki, a commission recommended closing more than 20 hospitals and shrinking and merging dozens of others. Stephen Berger, the investment banker who chaired that commission, would serve on Cuomo's first Medicaid redesign team, which cut funding for Medicaid during his first term. In 2013, Berger argued that more New York hospitals needed to close, writing that allowing hospitals that have outlived their usefulness to close is a necessary step in the transformation of our healthcare system. The safety net hospitals serving the city's poor were losing too much money, he wrote, and couldn't be sustained anymore, especially with the rise of community-based primary care. That year, the Cuomo administration approved the closure of the 500-bed Long Island College Hospital in Brooklyn over loud community protests. Cuomo basically turned the Department of Health into a rubber stamp for every closure certificate needed, Petty said. It's inarguable that Medicaid spending in New York is and will keep rising. At the same time, the COVID-19 pandemic is eviscerating New York's economy as a tax revenue evaporates. A spokesman for Cuomo, Rich Azzapardi, pointed to recent comments Cuomo made in response to questions about his continued push for a $400 million Medicaid cut. Yeah, look, we have no money, right? Life is options. The state has no money, Cuomo said. But it isn't as if the state government has no options. Activists, elected officials, and the New York State Nurses Association want Cuomo to raise taxes on the state's many millionaires and billionaires to make up for some of the looming shortfalls. Cuomo could also increase corporate taxes, further raise the millionaire surcharge, and reinstitute a tax on stock transfers, which the state ended in 1981. Technically, taxes are still paid on stock transfers, but the state refunds 100% of their revenue. In their January budget testimony, NYSNA estimated that a stock transfer tax could generate $20 billion annually. Empire State Indivisible, a leading progressive organization, has called for the creation. Where was I? Empire State Indivisible, a leading progressive organization, has called for the creation of special taxes for millionaires earning in excess of $5 million, billionaires, and a new tax on luxury homes and apartments. Cuomo approved a millionaire's tax in his first term in the aftermath of the 2008 economic crash, but has otherwise been averse to hiking taxes on the wealthy, possibly because his budget director used to work for the state Senate Republicans, who long held a majority, with Cuomo's tacit approval. Cuomo's resistance to raising taxes puts him out of step with even plutocrat-friendly executives. After 9/11, Mayor Michael Bloomberg, a billionaire himself, forced through a less popular property tax hike to fund city services at a time when businesses were reeling and few tourists wanted to come to the city. These days, the best hope for the healthcare providers and advocates who want to save hospitals from further gutting is for Cuomo to simply change his mind. As governor, he holds inordinate power over the state budget, where he wants his cuts enshrined. Lawmakers may have to choose between rejecting his cuts or shooting down the state budget altogether in a time of singular catastrophe. We need to do this in a calmer fashion. Right now, we are dealing with a crisis. Let us deal with the crisis, Rivera, the state senator said. We need to make sure the institutions dealing with the crisis aren't gutted post-crisis. Absolutely. And that's exactly what Cuomo ended up doing, by the way, because I did a 4-part series, Andrew Cuomo's the Worst. Check it out. Share it. It's awesome. I put a lot of time into it. 4-part video. And it's just absurd because he did force them to sign a budget because they needed funding for other things to address the pandemic, and he has this way of abusing power and being an authoritarian. Essentially, Cuomo was Donald Trump with a D in front of his name, and that's who the guy is. And this shows us this is just one way, just adding to why Andrew Cuomo is the worst. And maybe I should make this part 5, but that gets too long. So maybe I'll do a new series, why Andrew Cuomo is terrible. Or why Andrew Cuomo is no progressive. Maybe that's what I'll call this video. Or even close. Why Andrew Cuomo is no progressive or even close. Thanks for watching Punk Rock Politics. Please subscribe to the channel. Make sure you hit the subscribe button. Make this a nice short and sweet video for you. Give you the information. Give you a little backstory. I did more talking on this on other videos. It's just absurd. Andrew Cuomo is not who you think he is, and not only should he not replace Joe Biden, the person with the next most votes, they should reopen the primary to everybody that suspended their campaigns and didn't completely end their campaigns. Then Andrew Cuomo should probably really be in prison for some of the stuff he's done. He's an authoritarian. He really is. He's a bad person, and he's not who you think he is. And it's saying he's better than Trump at delivering coronavirus updates is not. That's a very low bar. A bar so low you can't see it. It's below the ground. So that doesn't make Andrew Cuomo good. And look at the outbreaks in New York and New Jersey and the deaths and it's just so large now. On today's date, which is May 10th, it's just absurd. So, this is his fault in a million ways. And look at who he is, and look at what he's trying to do. to an already ruptured and underfunded and underprepared healthcare system, which he was responsible for since 2011. It's 2020. And it's definitely time for not only Andrew Cuomo to go, but for him to be pushed into the annals of bad history and bad governance. He's not a progressive. He's not your friend. He definitely should not be president. He should have never been governor.